Good evening. Thank you for joining us tonight for Concordia College's first lecture in the Free Enterprise Lecture Series, funded by the Koch Foundation. For over a decade, Concordia College has brought our community a wide range of speakers and views, and tonight we are pleased to add this series to our offerings. You know, we live in an increasingly polarized society where shrill voices get in the way of civil discourse. Concordia has prided itself as a place where such civil discourse can flourish, and we can gather as a community to engage topics that are relevant to our individual and collective lives. Tonight's topic, healthcare, is about as relevant as it gets. Recently, Dr. Ted Marmer began this conversation on healthcare with this insightful analysis of the Affordable Care Act. Now, tonight's speaker will bring another perspective to this topic that is so vigorously debated in the public square. Our speaker, Dr. Betsy McCaughey, is a constitutional scholar first, with a PhD from Columbia University, a patient advocate and a health policy expert, and as many of you know, a former lieutenant governor of the New York State. In 2004, McCaughey founded and is now chairman of the Committee to Reduce Infection Deaths, also known as RID, a nationwide educational campaign to stop hospital-acquired infections, which has won legislation in over 27 states for public reporting of infection in our country. Dr. McCaughey's early career was as a constitutional scholar, as I mentioned. Her second book, Government by Choice, included a preface by U.S. Supreme Court Justice Warren Burger and a foreword by the legendary New York Senator Daniel Patrick Moynihan. Her career from constitutional scholar to lieutenant governor to a healthcare expert models the kind of life that we here at Concordia promote with our students, that lifelong learning should be all our endeavor. Incidentally, her second book, which I'm sure you're going to hear more about today, fifth book, her second was what I just talked about, her fifth book that you're going to hear more about today, Beating Obamacare 2014, will be available for sale outside in the lobby, and also she would be more than happy to sign it for you after the conclusion of this event. We are indeed honored and privileged to welcome Dr. McCaughey to our inaugural talk in the Free Enterprise Lecture Series, and thank her for sharing her expertise with us tonight. Please join me in welcoming her to the podium.
Thank you. I am so glad to be with you tonight, and for the millennials in the audience, to be between two ferns. This is the Obama Health Law. This law lowers your standard of care. It puts government in charge of your care. And it takes away something as precious as life itself, your liberty. I'm going to describe what the law says as written, and then describe the health reform that is currently being rolled out by the president, which bears almost no resemblance to this law. This law says that almost everyone is required to enroll in a one-size-fits-all government-designed health plan called the Essential Benefits Package. If you enroll in this plan, you will be shielded from a government penalty. When you go to file your taxes next year, according to the law, you will have to attach proof that you were enrolled in the government-designed plan or face a penalty. So enrolling in the plan will shield you from that penalty, but it will subject you to a level of government control over your health care and your doctor's decisions that is unprecedented in our country. Section 1311 H1B of this law empowers the Secretary of Health and Human Services for the first time ever to dictate how doctors treat privately insured patients. It states that insurance companies cannot pay doctors or hospitals unless they comply with whatever regulations the Secretary imposes in the name of quality. Well, that can cover everything in medicine. When your cardiologist chooses to use a stent versus a bypass, when your OBGYN orders a sonogram or does a cesarean. Your doctor will be required, or face financial penalties for not doing so. Your doctor will have to enter your medical information into an electronic database. The goal is one nationwide database where every patient has a page. Your doctor's decisions will be monitored for compliance with federal guidelines on how doctors treat each issue, each problem. And ultimately, your doctor may have to decide between doing what's right for you and avoiding a government penalty. The first time I saw that provision took my breath away. After all, we women have always taken a special interest in our medical privacy. And women's rights groups went to the barricades. Gloria Felt at Planned Parenthood and others went to the barricades to prevent the federal government from ever accessing a woman's health records or dictating to her doctor. Now these very same groups are supporting a law that does both, putting politics ahead of something so important like medical privacy. And when I see this blanket authority given to the secretary to dictate how doctors treat their patients, I say to myself, how can it be that a woman has a right to an abortion but not a hip replacement? How can that be? Now, the president said right from the beginning of his campaign for this legislation, he promised to solve the problem of the uninsured by making health plans more affordable. But that's not what this law does. In fact, the first year, this year, health premiums now are 41% higher on average than before this law was passed. 41% higher, according to a Manhattan Institute survey of the individual market in all 50 states. 41% higher. Instead of making health plans more affordable, what this law actually does is to vastly expand Medicaid and to offer subsidies to some people buying health plans on the Obamacare exchanges. Two big new entitlements. And how are these paid for? This law expands Medicaid by eviscerating Medicare. It takes $716 billion out of Medicare over this decade, $716 billion, and moves it over to fund the expansion of Medicaid and the subsidies. It's like robbing grandma to spread the wealth. The impact of these cuts are already being felt. Dr. Richard Foster, chief actuary of Medicare, he works for the president, although he just retired, but he warned Congress twice in testimony that these cuts to Medicare were so severe that 15% of hospitals would have to close, and that many hospitals would stop taking Medicare. Think about that. Where will seniors go when their local hospital stops taking Medicare? The biggest cuts are to what hospitals are paid to care for patients. And you've already seen some of the impact of that. As hospitals are paid less, they lay off nurses. And everywhere across the country, nurses are being laid off right now. And I say to people who know they're going into the hospital, maybe for a knee repair, try to cobble together enough money for a private duty nurse, at least for the first night. Because when you press that button for pain control or help, you're going to have to wait longer. There are fewer nurses on the floor. And if you're a baby boomer, in your late 50s or early 60s, line up your doctors now, your internist, your cardiologist, your orthopedist. Because if you wait until you turn 65 and go on Medicare, you will not be able to find a doctor willing to take you on as a new patient. Doctors are going to be paid so little under Medicare, less than they're paid to take care of any other kind of patient. Now, in addition to the across-the-board cuts to Medicare, there are some very specific and troubling cuts. Section 3000A of this law awards bonus points to the hospitals that spend the least per senior. Think about that. Not the least per patient, the least per senior. I wouldn't take my beloved dog to the vet that spent the least per animal. And there's copious evidence in the Archives of Internal Medicine, a study of almost every hospital in California, showing that the hospitals in the bottom quintile that spend the less per senior have much higher death rates from pneumonia and other common ailments that afflict seniors. In other words, seniors have a much worse chance of making it home again. So why incentivize all hospitals to imitate the hospitals where the death rates are highest? You know, 5 procedures have virtually revolutionized the experience of aging in our country. Hip replacements, knee replacements, angioplasty, bypass surgery, and cataract operations. Those 5 things have transformed the experience of aging. I remember when I was young, older people spent their later years trapped in wheelchairs, crippled with arthritis, or stuck in nursing homes, breathless from congestive heart failure. Now older people are out enjoying their lives, working longer, traveling, playing with their grandkids. I've got 2 right here. This law will undo that progress. The stakes are very high in this battle over Obamacare. Because if you're seriously ill, the best place to be is in the United States. A woman diagnosed with breast cancer in the United States has a 90% chance of surviving it. In Europe, her chances are less than 80%. Do the arithmetic. That means she's twice as likely to die. A man diagnosed with prostate cancer in the United States, it's not a death sentence here. But in Europe, nearly 1 out of every 4 men diagnosed with prostate cancer dies from it. And if someone in your family has what we currently call an incurable illness, this is the nation of hope. This is where the cures are developed. Since 1950, the United States has won more Nobel Prizes in medicine than the entire rest of the world combined. And that's why defeating this law is the fight of our lifetimes. Congress ought to take this 2,572-page law and put it in the paper shredder and give us a 20-page bill in plain, honest English that members of Congress will actually read before voting on it. I've written one, and it's summarized in the back of my book. 20 pages should be enough. The framers of the Constitution created the entire federal government in just 18 pages. It's the very size of this law, among other things, that makes it so dangerous. You know, Madison warned in Federalist 62 that there's no point in giving the American people an elected Congress, representative self-government, if Congress in turn passes laws so voluminous, that was his word, so voluminous that no one can read them, or so frequently changed that no one can know what the law is from day to day. That is Obamacare to a T. Now, I mentioned at the beginning that this is the law as written and passed in 2010, but it is not what the president is rolling out now. I've made a little picture for you. This is the Affordable Care Act as written. Gone is the employer mandate for middle-sized companies. Gone is the cap on out-of-pocket expenses. Gone is the essential benefit package requirement. You can keep your substandard plan, he recently said. Gone are over half the deadlines in this law. And as of last week, gone is the individual mandate for almost everybody. You can definitely get an exemption. And look what he's added. A special subsidy for members of Congress. When the law was written, it required members of Congress to enroll in these Obamacare plans and pay what everybody else paid. But Congress got cold feet. It wasn't going to be affordable for them because they only earn $174,000 a year base pay. So he arranged a special deal for them. 1,472 waivers for unions and companies, exempting them from requirements of the law. And just this Friday evening, after the close of business, he slipped in a new rule expanding the bailout for insurance companies to make it more generous than what the law already provided in Section 1342. So, what do we have here? Not only are we losing our access to our hospitals and our doctors, we are losing the rule of law. We are losing the framework for our free system of government. And it is time for this Congress to rein in this lawless president. Now, I'm not going to give you a political talk tonight. We're here to talk about health care. But let me say this. There is more at stake here than just our health care. The freedom of our nation is at stake because the president is grabbing for more power than the Constitution permits him to exercise. On the very opening page of the Federalist Papers, a hopeful Alexander Hamilton wrote, "It has been reserved to the people of the United States to answer the important question whether societies are capable of governing by reflection and choice, rather than always having to succumb to accident and force. It's up to us, our generations, older and younger in this room, to affirm that optimism and that commitment to representative self-government." Thank you. Lots of questions, I hope, especially from the students who are here. Yes, ma'am.
Who wrote this law?
Well, it was written by several committees in Congress with a lot of input from Ezekiel Emanuel and David Blumenthal, early advisors to the president, Tom Daschle, who was Obama's original pick for Secretary of Health and Human Services. They all played a part in this. But a lot of it was kids on committees. I hate to say that, but if you read this law as I have, you would see so many mistakes, so many contradictions. Yes, sir.
How can we stop the president from just deciding who has to follow the law, who doesn't have to follow the law? Is there nothing in place to prevent what's happening with these laws?
Well, this is one of the most interesting questions, and I spent quite a bit of time today talking with a member of the House Judiciary Committee, Congressman Steve King, about this. Madison and the other founders envisioned that the power of the purse would be the most effective way to rein in a lawless president short of impeachment. And last fall, a few members of the House and Senate tried that. But the American people didn't have the stomach to close the government down even for a day or two, much less longer, to hold this president to rein in his violations of the Constitution. But that's exactly what Madison envisioned in Federalist 56. So, those members of Congress who are concerned with protecting our Constitution feel a bit at a loss. In the past, the Supreme Court has not permitted members of Congress to sue the president when he violates the Constitution. They've ruled in the past that Congress lacks standing and that this kind of battle has to be resolved politically rather than judicially. But now, members of Congress who are concerned about this have written a statute, or written a bill that they hope to pass into statute called the FAIR Act that will empower members of Congress to sue the president when he violates the Constitution. So the House Judiciary Committee is moving as aggressively as possible. But let me say this, and this is political, so if you don't like this, you can cover your ears for a minute. One of the reasons this fall election is so important is not simply to slow down Obamacare, but it is to win a majority for freedom lovers in the US Senate. Win a majority of people who are committed to the Constitution so that the new Senate Majority Leader can take a walk down Pennsylvania Avenue and have a chat with the president about the implications of continuing to violate the Constitution. No one wants to put this nation through impeachment. We've only been through it twice, and those were both poorly chosen occasions. This is the first legitimate occasion for impeachment. But nevertheless, no one wants to see the nation go through that. But just having the threat of impeachment would probably be enough to chastise and discipline this president, holding the sword of impeachment over his head. Yes, sir. Oh, ma'am.
Hi.
Sorry.
Thank you so much for sharing, by the way. I have two questions. The first question that I have is, because you said in other countries, healthcare is not as successful because it's free. But what about the people here in this country who can't afford to get certain things and actually end up leaving this country, going to other countries to get that affordable health?
Okay, I'd like to answer that because that is a very important question. What about people who can't afford it? Well, the statistics I cited include everyone, not just people with private insurance. These are data comparing outcomes for all patients in one country versus another, and most of them are based on what's called the Concord Consortium, which you can find online. It compares cancer survival rates for almost every kind of cancer, nation to nation. So even people in this country who don't have insurance, and I believe everyone should have access to insurance, I've written a bill, as I said, to make that possible. Even those who don't have insurance, well, those who can't afford insurance are eligible for Medicaid. We already have a system in place for many people who don't have insurance. And anyone else, even if you've just gotten off the plane from another country and you're seriously ill, you can go to a hospital and be treated. It is against the law for hospitals to turn away sick patients regardless of their ability to pay. Yes?
I've been hearing numerous things on television and just from people that I know that drugs are not going to be paid for, they have to go on generic, and we know for a fact and family experience that sometimes the generic drugs do not work as well as the more expensive, especially with serious illnesses. That hospitals, there were 17 hospitals at the Cape Children, I heard only 4 hospitals are going to be available on the state exchanges. What are these sick people going to do?
This is a really important question because my major opposition to Obamacare, aside from the freedom issue, is not about the impact on the economy. Certainly it is having a very serious impact on jobs, on the availability of full-time jobs particularly. But worst of all is that these Obama health plans are not made for sick people. And yet we heard from the beginning that this was supposed to help people with pre-existing conditions. Well, in fact, in most of the states, most of the Obamacare exchange plans restrict you so that you can't have access to the doctors you were using before. You can't use the hospitals you were relying on before. And in many cases, the formulary, the list of drugs that you can get with your prescription does not include the drugs you really need. Let me give you a few examples. I spent quite a bit of time last week with a neurologist in Georgia who treats MS patients. And he said the Georgia Obamacare plans refuse to pay for 6 out of 10 drugs that MS patients need. And he said, I don't know what to do because that means they can't get the drugs to stave off the devastating paralysis that comes with this disease. Yesterday I was talking with a woman, Dr. Karen Albrecht, who was diagnosed with stage 3C breast cancer. Fortunately, she was diagnosed with it 2 years ago. And when her doctors at her local Nashua, New Hampshire hospital told her to get her affairs in order, she decided, no, I'm going to try to get this cured. So she went to the Dana-Farber Cancer Center in Boston and then later to the Cornell Breast Cancer Center in New York. And now she is in recovery. But she said if she had had the Obamacare plan that she now has to buy, she lives in Nashua, she'd be dead. She'd be dead because she wouldn't have access to those centers of excellence cancer hospitals out of state. So of all the things that I see wrong with Obamacare, these plans are not good for sick people, and yet we were told those are the very people who are going to be helped. Before this, 35 states had high-risk pools, they're called, where people with pre-existing conditions could get insurance, even though they weren't welcome in the regular commercial market. The plans in the high-risk pool were subsidized by the government, and people who were seriously ill could buy plans there. Now those high-risk pools in all those 35 states are closing, and those people are being forced onto the Obamacare exchange plans, which are just not good enough for seriously sick people. I received an email this afternoon from a mother in Texas whose son has epilepsy, and she said he can't get the drug he needs now to prevent seizures because he's on an Obamacare exchange plan. I have to tell you, of all the things that worries me or distresses me or just plain disappoints me, the biggest maybe is watching the president lie about this all the time. Lie about telling us that these are good plans when they're not. You know, one day he was giving a speech to volunteers out trying to get people to sign up, and he said, you're doing God's work. Well, helping the uninsured is God's work. But convincing people who have serious illnesses to sign up for a health plan that won't pay for the drugs they need, that is not God's work. If he were in the private sector, he'd be charged with fraud and he'd be on his way to prison. That's right. Yes, sir.
I know there's a lawsuit winding its way through the courts now challenging the legality of the federal subsidization
Yes.
of insurance plans. Would you,
Oral arguments next week.
before the Supreme Court?
Yes.
Okay. And can you handicap that at all?
You know, it's really tough to say. Let me just clue everyone in what this is about, because you obviously are extremely well informed about this issue. The way the law is written, only state exchanges can offer a subsidy to someone buying an Obamacare plan. And you know how expensive they are without the subsidy. The law was so carelessly drafted that the federal exchange, which covers more than half the states now, doesn't have the legal authority to offer a subsidy. Well, the IRS said, we're going to go ahead and offer it anyway, right? Yeah, regardless of the text of the law, we're going to offer it anyway. Well, fortunately, the state of Oklahoma brought a lawsuit saying, you're not offering those subsidies in our state. We didn't open a state exchange. And here's the reason they're opposing the subsidy. If someone goes to the exchange and gets a health plan with a subsidy, their employer gets whacked with a $3,000 penalty. And Oklahoma didn't want the businesses in the state whacked with those penalties. That's why they brought the lawsuit. And that's what gave them their standing to bring the lawsuit. So this is going to wend its way to the Supreme Court. And it's hard to handicap it after what happened with Justice Roberts. There are quite a few important cases heading to the Supreme Court regarding Obamacare. 100 cases in all currently in the federal courts. 100. Yes, sir.
At the end of the day, to politically change Obamacare and to repeal it, and you're not going to repeal it unless you've got a new one, so whether you call it repealing it or putting in a new one, or making major changes in it so it doesn't bear any resemblance to itself, the bottom line is going to have to be reducing the cost of health care. Now, we know that there's nothing in Obamacare that actually reduces the cost. And as far as I know, the only things that are out there that really reduce the cost are individuals paying for their own health savings accounts and tort reform.
Yes.
Is that enough? Or are there other things out there that can actually create a new law that can actually work to reduce the cost of care?
Well, the market, it's always hard to predict. But market competition has a much better shot at reducing the cost of anything, whether it's gasoline or healthcare, as opposed to government simply imposing price controls. We know that doesn't work. It hasn't worked any time it's been tried. Let me give you a little bit of a landscape about what's happening. This law, it's almost dead. It's almost dead. As you can see, major portions of it, including the individual mandate, the employer mandate, the essential benefit package, all the core items in this law have been waived, postponed, or literally obliterated. The president is hacking his own health care law to death. Whack, whack, whack. Every time a portion of this law even promises to be unpopular, he just says, well, we'll do away with it for a year, 2 years, 3 years. Most of the major provisions in this law have now been postponed till the end of 2016, right? All by fiat, by executive power, right? Against the law. So it's on life support. And the Democrats in Congress don't want to have anything to do with it. They are running away from it as fast as possible because popular opinion is so against it now. Not just Republicans against it, but people who have just plain been hurt by it. You know, last year, in the first 7 months of the year, 77% of the jobs created in this country were part-time. Who can support a family cobbling together 2 or 3 part-time jobs? But that's what the employer mandate did, right? So Democrats are running away from this law. And it appears, perhaps even before the November election, that there may be grounds for a temporary, very temporary, compromise to stop the bleeding. What would that look like? It would maintain the Medicaid expansion in the states that have chosen to expand Medicaid, helping the neediest. It would keep popular items like allowing children to stay on their parents' plan till they reach 26, right? Very popular. It would repeal the employer mandate, the job-killing mandate. And it would eliminate the threat of this tax on people who don't enroll in Obamacare. Bad enough that you're uninsured, you got to pay the tax too, right? The grounds for a compromise are obvious, and more Democrats who are so worried about re-election are moving in that direction. Mary Landrieu in Louisiana, Jeanne Shaheen in New Hampshire, people who voted for Obamacare in the Senate and know they cannot get re-elected. There is nothing more malleable than a frightened politician, right? And then, in 2016, the voters will decide for sure, based on whom they choose for president. My view, they need to choose a president who is committed to repealing this law and taking his or her oath to uphold the Constitution very seriously. At that point, whoever is in the majority, it may be Republicans, can sit down and design a replacement that will pursue laudable goals. I would suggest, as my 20-page bill does, let's have a subsidy available for people who lose their job and need to pay COBRA premiums till they get another one. Help the industrious who are temporarily out of work. Those COBRA premiums are so expensive. That's a time to help somebody out and bridge that uninsurance gap, right? Tort reform, as you pointed out, sir. Let people have the freedom to buy health plans wherever they want to. You know, we New Yorkers, and I assume most of the people here are New Yorkers, we've been prisoners of the worst health insurance laws in the country, aside from Massachusetts. And the result is that we've had the second highest premiums in the country for many years. A 25-year-old in California, until Obamacare came along, only paid a third as much as a 25-year-old in New York for health insurance. And the result is, in a state with 18 million people, only 18,000 bought individual plans in New York, 1%, because it was such a lousy deal, right? So give people the freedom to say, you know, I can't find a health plan I like in New York, but I think I'll buy that health plan out in Illinois, right? It doesn't mean you have to go to a hospital in Illinois. So that would make a lot of sense. And there are some other reforms we could add in to make health insurance more affordable. But the idea is help the truly needy and leave everybody else alone to choose the kind of health insurance they want. Don't force us, herd us into a plan that denies us care when we're truly sick and shakes us down. You know, these premiums on the Obamacare exchanges, they're not expensive because you're getting gold-plated coverage. They're expensive because they include $100 billion in taxes, right? $100 billion in taxes imposed on insurance companies with the understanding the insurance companies would hide them in the premiums and charge you the money, which is exactly what's happening. So you're not getting health care for your money. It's another way of taxing you. And that's another big lie. This bill, it's a big lie. And that's probably the worst thing about it.
I don't know what I'm talking about this, but I read 3 articles about the breakthroughs in medical research, where they think that they can now track to a few genes down to their base and use semiconductor technology to go down the cost curve. And that could be one of the
Very important. You know, it's a very interesting thing. What Chuck has just mentioned. First of all, this law denies us the benefits of medical science. Everything about this law seeks to standardize medical care. It makes doctors into robots. They have to do it this way. You go see a doctor this year, and suddenly, instead of having an eyeball-to-eyeball conversation, am I right? He's got his head in a computer. He's got to fill out all these forms, right? It has nothing to do with the patient anymore. And it's the standardization of medicine. Read Zeke Emanuel's book. It's enough to make you sick. He uses the word standardization 100 times in that book. And I think, who is he to think the federal government should tell every doctor how to treat their patient? That the federal government knows better than that highly trained doctor standing next to you in the examining room? But even more than that, it denies you the benefits of medical science, because science is moving in the direction of personalized medicine, not standardized medicine, right? Line up 5 women with breast cancer. You can't treat them all the same way. It's a different genetic mutation that's affecting each one of them. So it's a deadly recipe. Now, as Chuck just mentioned, technology is a two-edged sword. On the one hand, technological innovation is responsible for most of the cost increases in medicine. But who wants 1980s medicine at 1980s prices? A heart attack patient lives so much longer now and has a much better quality of life because of technology. Walk into an electronics store, and you won't see anything that you saw 5 years ago. It's all new stuff. Walk into a hospital, it's the same. And that's the way it ought to be. Who wants to stop medical progress, right? Sometimes these technologies save money, like anesthesia-reducing drugs, right? Other times they add to costs, but they benefit us so by expanding our lives and the quality of our lives. You know, someone of my generation is going to live 7 years longer. 7 years longer than someone in my parents' generation. 7 years. What a gift! And 7 wonderful, healthy years. Who would turn that away? Right? It's the most wonderful gift anybody can get. 7 extra years of life because of medical innovation and diet and other improvements in our society. This law doesn't keep any of that in mind. Yes?
I just wanted to ask, and you made some really valid arguments, and I totally agree with, people who are less fortunate, we should still help them. However, things like Medicare, what kind of quality of care are they getting? They're still getting less quality than people who have the means to get good health care.
I think you're thinking of Medicaid, not Medicare. Medicare is for the elderly. Well, let's not call them elderly. Over 65. And Medicaid is for people who are low income. So you're talking about Medicaid. And I would like to see Medicaid improved. In fact, improved before it's expanded. Medicaid is not as good as it should be. I'll give you an example. The University of Virginia did a study a couple of years ago on surgical patients and found that patients on Medicaid had a lower survival chance than patients with no insurance at all. So, because so few doctors take Medicaid. And that's the problem with it. That's the problem with politicians. It's always the broken promise. They promise health care to somebody on Medicaid, but then they turn around and break the promise by paying doctors so little that nobody will take Medicaid. It's broken promise medicine, and we need to improve it. I fully agree with you that we need to improve Medicaid by paying Medicaid doctors more.
How do we do that? How do we get people to do that? If we're not going to have Obamacare or things like that, then how can we as a society get together and help these people?
We need to, instead of vilifying the medical community, which is what President Obama did as a way to get his law through, it was amazing to me. What a salesman. I couldn't believe that he could convince Americans that politicians were more honest than doctors. But he did. Remember him standing in Congress talking about the fictional pediatrician who would take kids' tonsils out for the money. So we need to really engage the AMA and other medical organizations to convince lawmakers that instead of expanding Medicaid, first they need to fix it so that Medicaid pays a fair rate for services. Because once you give somebody a Medicaid card, it's unfair to say, but I'm sorry, no doctor will take this. Oh, this lady up here and then this man. Why don't we do two? It's not fair.
So I just wanted to address the student that I had a sister in Virginia who worked all her life. She's about my age, didn't have insurance. She's getting the best care. She's uninsured. Whatever, that a woman who's 60 will click in. But here she is in the United States, no income as of recently, very sick, and she's getting the best medical care. Right. She's able to choose. They drove 2-4 hours to an institution, in another state to treat her cancer. And it's amazing, and she has nothing. Yeah. So people that don't have any insurance aren't being treated. Yes. And people, they
until this law was passed, there was something called uncompensated care. If a patient went to the hospital, was treated and couldn't pay the bill, that was added to the uncompensated care column. And then when insurance companies sold insurance to everybody else, they raised the premium up because the payers, the people who went to the hospital with insurance, would be billed extra, and part of that would be moved over to pay for someone who didn't have insurance. That's the way the system has always worked. Sir?
I have two questions. My first question is, what provisions would you propose to make to Medicaid and Medicare? And my second question is, what course of action do you think must be taken to help small family doctors and local doctors compete with group clinics?
Let me just go to the second one first, because this law is designed to drive doctors in solo practice and small partnerships out of business. Am I right, Doc? Yes. Out of business. There are a series of requirements that are imposed on doctors in the stimulus legislation that came before this and in this law that make it financially impossible for a doctor to operate a practice. And that's why so many doctors are selling out to hospitals or going to work for hospitals, and the patients really lose. Because it's a wonderful thing to have that kind of close relationship with your doctor. So that's really unfortunate, and repealing this law will go a long way toward protecting the medical profession as we've known it. And I have to just tell you that those of us in the audience over, let's say 40, we have lived through the golden age of medicine. I feel so privileged to have benefited from it, to have seen my family benefit from it, to have seen my family benefit from the kind of care that doctors who are well-educated, independent, and able to make decisions with and for a patient, free from that kind of government intervention that in countries like England prevents doctors from acting aggressively enough or quickly enough to cure, for example, a cancer patient. So it's a wonderful thing, and we can't let it slip through our fingers. Yes?
The law, the way it's written, okay? I'm hearing that, say my employer provides me with a family plan, okay, with a fair market value of $20,000 a year. I'm hearing that in this law next year on my W-2. That's
oh, yes, Box 12. It's actually this year. And guess what? Here's an implausible explanation. When you get your W-2 this year, it's going to have something in Box 12. It's a new box. The value of your employer-provided health plan. And they're telling you what it's worth just so you'll appreciate it. How's that? Right. Should I stand between the two ferns when I say that? They're obviously planning to tax it. Thank you very much.